Renal and urogenital systems. Chapter 9. Pathology. Alterations in renal function. Biological variances. Kidneys and tubular system mature throughout childhood, reaching full maturity during adolescence. During first 2 years of life, kidney function is less efficient. Bladder capacity increases with age 20 to 50 milliliters at birth. 700 milliliters in adulthood. Urinary output. Urinary output per kilogram of body weight decreases as child ages because the kidneys become more efficient. Infants 1 to 2 milliliters/kg per hour. Children 0.5 to 1 milliliter/kg per hour. Adolescents 40 to 80 milliliters per hour. Urinalysis protein leukocytes, red blood cells, casts specific gravity. Urine culture for bacteria. Diagnostic tests, urinalysis, ultrasound. VCUG, voiding cystourethrogram. IVP-intravenous spielogram. Cystoscopy. CT scan. Renal biopsy. VCUG. IVP. Intravenous spielogram. Kidney function analyzed. Watch for allergic reaction. To die, renal biopsy. Cystoscopy, invasive surgical procedure, visualizes bladder and ureter placement, CT scan. Treatment modalities: urinary diversion, intermittent catheterization, stents, drainage tubes. Intermittent catheterization. Watch for latex allergies. Pharmacological management. Antibiotics. Anticholinergic for bladder spasm. Urinary tract infection. Most common serious bacterial infection in infants and children. Highest frequency in infancy. Uncircumcised males have a 10-fold incidence. Etiology: anatomic abnormalities. Neurogenic bladder, incomplete emptying of bladder. In the older child, infrequent voiding and incomplete emptying of bladder or constipation. Teenager, sexual intercourse due to friction trauma. UTI, females, most common in females, short urethra, improper wiping. Nylon underpants. Current guidelines: do ultrasound with first UTI followed by VCUG if indicated. UTI, males, infant males, needs to be investigated. VCUG, ureteral reflux. Ultrasound of kidneys, hydronephrosis or polycystic kidneys. Higher in uncircumcised males. Uncircumcised males. Instruct parents to gently retract foreskin for cleansing. Do not force the foreskin. Do not leave foreskin retracted, or it may act as tourniquet and obstruct the head of the penis, resulting in emergency circumcision. Clinical manifestations: UTI. Urinary frequency. Hesitancy. Dysuria. Cloudy, blood-tinged. Musk smell to urine. Temperature. Poor feeding, failure to grow. The neonate may only exhibit 6 and 7. Interventions: antibiotic therapy for 7 to 10 days. E. coli, most common organism, 85%. Amoxicillin or sphazole or Bactrim or Septra. Increase fluid intake. Cranberry juice. Sitz bath, tub bath. Acetaminophen for pain. Teach proper cleansing. Urethritis, urethral irritation due to chemicals or manipulation. Most common in females. Bubble bath, scented wipes, nylon underwear. Self-manipulation. child abuse, ureteral reflux. Ureteral reflux, males 6 to 1 genetic predisposition, present as UT or FTT. Diagnostic tests: antibiotics if indicated, surgery to reimplant ureters, hydronephrosis. Hydronephrosis, water on kidney due to obstruction, congenital anomaly. Goals of care to maintain integrity of kidney until normal urinary flow can be established. Clinical manifestations: history of UT, followed by flank pain, fever and chills. Decrease in urinary outflow. Neonate may present as UT. An older child may be asymptomatic except for failure to thrive. Diagnostics: ultrasound VCUG, voiding cytourethrogram. IVP is the first two are positive. Goals of treatment to preserve renal function. Temporary urinary diversion may be needed to relieve the pressure. Nephrectomy if renal damage is not reversible. Long-term complications: urinary incontinence, infection, body image, inadequate sexual function, hypospadias. Cryptorchidism, hidden testicle, 3 to 5% of males. High incidence in premature infants. Goals of treatment: preserve testicular function, normal scrotal appearance. Treatment: most testes spontaneously descend. Surgical procedure: orchiopexy, if testicles do not descend into the scrotal sac by 6 to 12 months of age. Hormone therapy, human chorionic gonadotropin. Slightly higher risk of testicular cancer if untreated. In the teen or adult, the testicle would be removed. Long-term: monthly testicular self-examination is recommended for all males beginning in puberty, but is essential in males with history of undescended testicle. Testicular torsion, rotation of the testicle. Spermatic cord twists and obstructs circulation to the testis. Left testicle affected more. Longer cord on left side. Clinical manifestations: sudden severe pain in the scrotal area. Highest incidence on left side due to longer cord on that side. Goals of treatment: surgical intervention to relieve obstruction, preserve the testicular function, secure testicle to avoid further twisting. Acute renal failure, prerenal, resulting from impaired blood flow to or oxygenation of the kidneys. Renal, resulting from injury to or malformation of kidney tissues. Postrenal, resulting from obstruction of urinary flow between the kidney and urinary meatus. Renal failure, newborn causes, congenital anomalies, hypotension. Complication of open heart surgery. Renal failure, childhood causes, dehydration. Glomerulonephritis, nephrotic syndrome. Nephrotoxicity, drug toxicity. Clinical manifestation: ARF. Sudden onset. Oliguria. Urine output less than 0.5 to 1 ml/kg/hour. Volume overload due to retained fluid. Hypertension, edema, shortness of breath. Acidosis,